I'm Dr. Christina Adams. I am an OBGYN hospitalist and I work in St. Augustine. OB was kind of the best of all the worlds. It was doing deliveries, it was surgeries, and it was getting the opportunity to have long-term relationships with patients. I personally experienced burnout and know a lot of my friends who've experienced burnout. And so one of the things that I did when I felt like something needed to change was I started consuming podcasts, a lot of which were written by physicians who learned to be coaches, and got some group coaching and then some individual coaching and saw how much it helped me. And then I wanted to bring that to other physicians and help with that issue. First of all, female physicians are generally expected to work as if they don't have kids and to parent as if they don't have a job. And we are perfectionists at baseline. And to feel like you're not doing a good job at either aspect of your life is kind of a challenge. Where's that permission slip? And are we out of toilet paper? And all of those sorts of things play into women getting burned out because you're just trying to juggle all the balls and keep them all in the air. And it becomes more than one human can manage. And then as we progress in our careers and try to get into leadership also, there, again, are different expectations of women than men in terms of what's called the double bind, where you're kind of walking a tightrope between not being assertive enough to be perceived as a good leader without being viewed as aggressive or bossy. And we have to sort of work through that perfectionism and figure out how to cope with that and realize that our best is enough and that we can't be all things to all people. A lot of times burnout shows up as being angry, either at your staff, a family member, or irritated with the patient about things that when you sit and really have time to think about it and look at it, you're like, I shouldn't be angry at the patient for that. Burnout is basically a chronic stress condition. OBGYN is one of the highest specialties in terms of self-reported rates of burnout. The statistic that always shocks me is that 40% of women physicians either cut back to part-time or leave practice altogether within the first 6 years after finishing training. A lot of times women are either saying, I can't do this full-time because I'm trying to carry the load at home and work clinically. It hurts patients. It hurts those of us who are left behind trying to practice in a system where there's fewer providers to provide care. And so all of those things are things that I have coached people on, things that I've been coached on myself, and that are challenging. We've got to figure out a way to make the practice of medicine more sustainable for women physicians. There are a lot of ways to do that: boundary setting and job sharing, being open to alternative scheduling models and those sorts of things. But medicine has not been ready for that largely up until recently. Being able to set boundaries and protect those boundaries, even when it disappoints people who we care about and people whose opinions matter to us, because no one else is going to protect your time but you.